Hi, good afternoon. My name is Erin Holliday, and I wanted to talk to you about otitis externa. I am a nurse, and I was going to give you some education regarding otitis externa related to a case study presented for our classroom about a gentleman that presented to a clinic with classic swimmer's ear symptoms, and he was also a member of a swim team. So the diagnosis seemed pretty clear as otitis externa, and I wanted to just discuss that with you. The pathophysiology of otitis externa, or swimmer's ear, which it's more commonly known as, it's a condition of inflammation that exists inside the external ear canal, and it's really directly related to repeated exposure to water, or at least a moist environment for the ear canal. There's earwax, of course, in the ear. When that gets diluted and the pH inside the ear canal changes, it can cause bacteria to flourish inside the ear canal. The primary bacteria that do cause acute external otitis is Pseudomonas, Proteus vulgaris, and Staphylococcus aureus, also Escherichia coli, which made me wonder a little bit, but then I got to thinking about dirty hands potentially going in ears, and those types of bacteria that would normally live in the ear canal. So warm, wet environments cause bacteria to grow. There are some predisposed conditions that can put some people more at risk for developing swimmer's ear. That would be an ear trauma. Let's say that there was an issue with a earplug, or if you put your finger and had a fingernail that scratched the inside of your ear canal and went swimming, could present a problem. Allergies, psoriasis, eczema, dermatitis, microabrasions from swabs, and Q-tips, which even though everybody loves, they're really not that good for your ears. And then just the decreased ear canal acidity, which I had mentioned a few minutes earlier. Repeated water exposure, changing the pH inside the ear, causing the flora to explode and create infection. Many people are really familiar with the term of swimmer's ear. You may have even had it yourself. I know I've had it. I have a child that is a swimmer who swims on a swim team. We've dealt with it. And the prevalence is very, very common. It was shocking for me to hear how much. But in 2011, swimmer's ear, according to CDC, I should say, in 2011, swimmer's ear led to 2.4 million doctor visits and was responsible for $500 million in annual healthcare costs. That was actually shocking to me. But some signs and symptoms to look for if you feel that you might be suffering from swimmer's ear, or have a child or a spouse or somebody that you know. Pain and drainage from the ear canal. There could potentially be hearing loss or dullness. The ear canal could be swollen and really painful to touch. There could be pressure over the tragus area. And if you did go to urgent care or saw your doctor, the otoscope, the device that is put in the ear, and trying to do the examination could be very, very painful. So pain, drainage, potential dull hearing. You might even be able to hear a little bit of water sometimes sloshing into that ear area, but very, very painful to touch. The treatment for otitis externa, besides, you could use some over-the-counter NSAIDs just for the general pain and discomfort, is gentamicin ophthalmic ear drops. And that's a 3%, 30 milligram and 10 ml vial. Those drops are 2 to 3 drops and should be instilled 3 to 4 times per day. And as always, look at your prescriber for the specifics of how many times per day. One really important thing that I wanted to share was that the drug should not be given if the eardrum is ruptured, because gentamicin in general, one of the systemic side effects can be hearing loss. I really wanted to focus on side effects related to just the ophthalmic gentamicin, because there's a lot of side effects of gentamicin if it's given systemically, but since we're talking about swimmer's ear, I really just wanted to focus on the potential side effects of the ophthalmic delivery system. But I just want to be clear, do not give this eardrop if the eardrum has been ruptured, because there could be more hearing loss. That being said, hopefully your provider who's written it has checked your ear with an otoscope, and that's not the issue. Some side effects with gentamicin ophthalmic include local sensitivities to the ear, some ototoxicity, some vestibular disorders, which means there could be some dizziness, potential hearing loss, like I mentioned. And one other point that I wanted to make was that there has been no established safety concerns for pregnancy and lactating women with ophthalmic gentamicin. And again, we're talking about ophthalmic gentamicin, not systemic or IV or oral gentamicin. The best way to treat and manage, in my opinion, swimmer's ear, once you get through a bout of it and you deal with your gentamicin, and you're, of course, excluding yourself from a water environment, is to take a preventative, proactive stance to not get it again. Because if you've ever had it, it can be very, very painful. So in my household, my swimmer, we use some custom earplugs. That may not always work for everybody, but it has helped. One of the easiest things that you can do once you get out of the pool is to dry the ear after exposure, whether it's the pool, whether it's the shower, but to dry it with a dry towel. Do not put your fingers or cotton swabs in the ear to dry it out. I know it's tempting, but your fingers and your fingernails have bacteria, and cotton swabs can cause microabrasions to the ear canal. When you get out of the shower, get out of the pool, out of the hot tub, you can touch your ear to your shoulder. Let the water drain out of the ear canal. Shake your head. Sometimes you can even feel the water coming out. Some people swim better with a swim cap that fits tightly over the head that can cover the ears, prevent water from getting in there. One of the other things that was noted, and I found it through inside the Merck manual, but was some home remedy idea to prevent swimmer's ear, but there was a recommendation of a 1-to-1 mixture of rubbing alcohol and vinegar that you can mix yourself and use an eardropper and put a few drops in your ear after water exposure or concern that the ear canal may not be drying. The key to that is just having the ear canal be dry. A dry ear canal will not breed bacteria. Okay, next slide is okay, everybody, this is our demonstration on how to appropriately administer eardrops. Okay, everybody, this is our demonstration time for our gentamicin eardrops. So my daughter Emily, who I mentioned earlier in the video, is a swimmer, and she's also modeling her swim cap for you, so you can actually see how tight these are. And if you were somebody that was struggling with swimmer's ear, you could wear a swim cap. It helps prevent fluid from getting into the ear and keeping the ear canal wet. But if you needed to give someone eardrops, here actually is a bottle of gentamicin eardrops. But first and foremost, we would be washing our hands. Then we would take the bottle, knowing that you would give either 2 or 3 drops. First things first, if it's indicated, you can shake these eardrops. But the other thing you may want to do is just warm them up. You can see me taking the vial and kind of warming these eardrops up, because cold eardrops in the ear can be very unpleasant. So once I'm warming them up, you would have your patient either bend down in this way and tilt their ear to the sky or the ceiling. You want to take the top off of the eardrop. I'm going to take my right hand, as I'm right-handed, and you will grab the top of the ear and pull it up and back. Take your vial and place it directly over the ear canal, administering 2 to 3 eardrops. Very important, you don't want to touch the ear canal with the end of the dispenser, because it is then considered contaminated. Once you have done that, release the ear, and the person or patient should keep their ear just like this, in this position, for at least 5 to 7 minutes, so that that medicine is able to absorb inside the ear canal and do most good. You would then take the top, put it back on the dropper, again, being very mindful to not contaminate it, and then go and wash your hands again. And you're ready for a next dose. Thank you.